In this video, we're going to talk about recording lines and devices. It's important to record your lines and devices on Cerner, not only for the patient, but also for yourself. It's very easy for us to generate a logbook for you of your procedures after you finish at ICU. The way you do this is select a patient. Here, I'm going to select a test patient. I'm going to go to the OBS and assessment, and then to the lines and devices navigator band. If you don't see a navigator band for lines and devices, then go back and watch the video about setting that up. From the left-hand side, you can see we've got a number of different devices, and for any of these, you should create a record within the OBS and assessments lines and devices category. I'm going to insert an arterial line. Selecting arterial line, and from the little square box here, I'm going to add a new group. This will bring up our usual or commonly used sites. I'm going to say that this was inserted into the left radial artery and a 22 gauge arterial line. Once I've selected those options, it's created a repeating group for me. The activity will be insertion, which will then bring up a number of different boxes to complete. Simply go through, making sure to include your name under the inserted column. I'm going to search by surname, click on the search box, and then select my RQM login. If you have a cosign login, be sure to select your RQM login for us to create a logbook for you at the end. Finally, the key information is to include the insertion date and time. We understand that at times clinical priorities can mean you can't fill in all of the information, but be sure to at least fill in basic information including the site and the date and time of insertion, so that Cerner will then be able to keep track of when that line and device was inserted and how many days it has been in, rather than you having to calculate it manually. A little tip here is you can click in box and press T for today. I'm going to do the same here, and clicking at the bottom, Cerner will calculate that this line has just been inserted. To finalize everything, click on the sign box. It's that little green tick in the top left. Or if you've done this by mistake, you can click cancel. Here on this test patient, I'm going to click sign. Now if I go back to my ICU daily review under patient summary, I can look in the lines, tubes, drains column. Refresh this box, and you can see that my arterial line appears here, including the inserted date. If I want to figure out how long it's been inserted, I can scroll down to the bottom, where it's been inserted for 0 days as of this time today. If I want to find out how long it's been inserted, rather than having to manually calculate it, clicking on the box on the right hand side and scrolling to the bottom, Cerner will have calculated for you that it's been inserted for 0 days. Hopefully that'll make your daily reviews easier. Just remember to include all the information you can, and that at the end of your time, ask us for a logbook, and we'll be able to provide you one with everything you've documented on Cerner.